The landscape for organ donation and transplantation is complex, but at its heart, it is about people, generosity, and saving lives. Organ procurement organizations, or OPOs, work within this system by collaborating with the many other organizations that make the generous gift of life possible through organ donation. Of course, the organ donation process is centered around the donor, the recipient, and their families. OPOs work with the primary contributors to the process, including donor hospitals and transplant centers, but there are many other components and partners in this ecosystem. OPOs work with a wide range of partners, and the outcomes of the organ donation system depend on all entities working together to honor the generous donors and save lives. OPOs are the federally designated, not-for-profit entities responsible for helping donor hospitals identify potential organ donors and supporting donor families through the donation process, including through authorization and grief support. Once a donor has been authorized, OPOs help ensure that the organ recovery happens safely, timely, and with respect for the donor and their family. OPOs are also responsible for ensuring the recovered organs are transported to a transplant center so they can be transplanted into the recipient. Throughout this process, OPOs collect data to help improve care, safety, and life-saving outcomes. Staff at OPOs include highly skilled and trained healthcare professionals and coordinators who work directly with organ donors, donor families, and hospitals to guide the recovery, transport, and allocation of donated organs. The OPO team also includes laboratory providers, medical device companies, research partners, and tissue banks, all working together in support of donation and transplantation. OPOs are often supported by community members and donor family advocates who may serve on the governing, advisory, or foundation boards and volunteer at community events to help OPOs carry out their mission. They also work with environmental monitoring contractors to maintain safe, high-quality clinical environments for their facilities. OPOs rely on secure IT systems, specialized staff, and support contracts to manage organ donor records. They also collaborate with organizations that specialize in telepathology, teleradiology, and telecardiology to support their mission. In addition to their own staff and contractors, the success of an OPO's life-saving work depends on many other trusted partners. First, let's look at donor registries, which allow people to make a personal decision to sign up as an organ, eye, and tissue donor. Many states operate such registries, for example, so that people can register as a donor when applying for a driver's, hunting, fishing, or other state license. In addition to state registries, Donate Life America hosts a national donor registry to help promote organ donation registration across the United States. People are able to sign up as an organ, eye, and tissue donor in Donate Life America's national registry at registerme.org. The decision to become an organ donor is legally binding, which helps ensure a person's generous decision can be honored by their family and the OPO. Next, we'll look at donor hospitals, where patient care, family support, and the possibility of donation come together. Donor hospitals include key staff in emergency departments, intensive care units, and operating rooms, as well as hospitalists, physicians and other hospital providers who declare death, social workers, family support services, administrators, ethics committees, and lawyers. Hospitals are large, complex ecosystems that serve as the foundation of the organ donation process. Sometimes, donors are moved to donor care units, where specialized teams can care for the donor while protecting the health of the organs until organ recovery can take place. Donor care units also provide a supportive environment for the donor families throughout the organ donation process. These donor care units can be in a donor hospital, in a community hub donor hospital, or in an OPO's facility. Because of the many moving parts in the organ donation process, transportation plays a key role. Transportation entities involved with organ donation include commercial providers like couriers or airlines, emergency medical services, the Transportation Security Administration, private ground transportation, transportation technology companies, and charter air companies. Transportation providers may move a donor hero to a donor care unit or hospital, move recovered organs to patients at transplant centers, or move OPO staff who need to be on the ground at hospitals across their designated service areas, which can be quite large. Transplant centers are essential partners in the organ procurement ecosystem. After an OPO identifies a potential donor, transplant centers assess each organ, determine medical suitability, and accept organs for their matched patients. Working closely with OPO teams, they coordinate timing, share clinical information, and ensure organs are transplanted safely and quickly. OPOs and transplant centers form a united network that honors donor gifts and helps save lives. In addition to the individuals and organizations involved directly in the physical donation process, laws and regulations also matter and help safeguard the system. Let's look at federal regulators and contractors. Congress passes laws related to all aspects of the donation and transplantation process. A key regulator is the Centers for Medicare and Medicaid Services, or CMS, and all of its contractors, which also have separate regulatory authorities to oversee the performance and certification of OPOs. In addition, the Organ Procurement and Transplantation Network, or OPTN, is a key regulator in the organ donation and transplantation ecosystem, particularly of OPOs and transplant centers. OPTN is run by the Health Resources and Services Administration, or HRSA, and establishes policies to keep the donation and transplant system safe, reliable, and effective. Lastly, the Food and Drug Administration regulates OPOs and other facilities involved in tissue donation. A complex network of federal regulators and their contractors influence the ecosystem. In addition, there are state, local, and tribal regulators. In some cases, the judicial system may be involved in making organ donation decisions, particularly when the death requires investigation. Sometimes medical examiners, coroners, and local police departments also get involved. Finally, the news media promotes potential organ donation and success stories related to transplants of donated organs, and informs the public of the need for donated organs. By the same token, media serves as a partner by promoting facts about the donation and transplantation process and sharing stories of those impacted by donation and transplantation to build public trust. In conclusion, the ecosystem in which OPOs do their work is incredibly complex, but its purpose is to honor donor heroes, support families, and save lives through the generous gift of life. Every part of the system depends on collaboration, trust, and shared commitment for it to be successful.